Hello guys and welcome back. In this video I'm going to talk about the PISA method. This is a very simple quantitative measurement for the assessment of valvular regurgitation. I hope you enjoyed this video and don't forget to subscribe to my channel. So let's start. First, we have to know what is a valve regurgitation. A regurgitation is the name for leaking heart valves. Sometimes the condition is minor and may not require treatment. At other times, valve regurgitation places a strain on the heart. It can cause the heart to work harder and it may not pump the same amount of blood. And when a regurgitation occurs? A regurgitation occurs when blood leaks through the valve leaflets that don't close correctly. Valvular regurgitation has long been recognized as an important cause of morbidity and mortality. Although the physical examination can alert the clinician to the presence of significant regurgitation, diagnostic methods are often needed to assess the severity of valvular regurgitation and remodeling of the cardiac chambers in response to the volume overload state. Echocardiography with Doppler has recently emerged as the method of choice for the non-invasive detection and evaluation of the severity and etiology of valvular regurgitation. Valvular regurgitation or incompetence results from various etiologies including valvular degeneration, calcification, fibrosis or infection, alteration of the valvular support apparatus, or dilatation of the valve annulus. These conditions cause poor apposition of the valvular leaflets or cusps and may lead to prolapse, flail, restricted leaflet motion, or valvular perforation. Doppler techniques are sensitive to detection of valvular regurgitation. Doppler echocardiography is critical to initial and longitudinal assessment of patients with valvular regurgitation. It provides detailed anatomic and functional information and clarifies the mechanisms that play a role in valvular regurgitation. Doppler echocardiography not only detects the presence of regurgitation, but also permits to understand mechanisms of regurgitation, quantification of its severity, and repercussions. In clinical practice, the management of patients with valvular regurgitation largely integrates the results of echocardiography. That's why it's important to provide standards and establish a baseline list of measurements to be performed when assessing regurgitation. Practically, the evaluation of valvular regurgitation requires the use of different echocardiographic modalities, should integrate multiple parameters, and should be combined with clinical data. So, how do we assess a regurgitation? Two-dimensional transthoracic echocardiography is recommended as first-line imaging in valvular regurgitation and is often sufficient for diagnosis. Two-dimensional transesophageal echocardiography is indicated when transthoracic echocardiography is insufficient or when further diagnostic refinement is required. Three-dimensional echocardiography provides realistic and intuitive anatomic images of valvular apparatus, which may provide additional information, particularly in patients with complex valve lesions, and allows more accurate quantification of hemodynamic consequences of the regurgitation on cardiac chambers. In practice, the evaluation of valvular regurgitation starts with two-dimensional transthoracic echocardiography, which can orient readily to a severe regurgitation in the presence of a major valvular defect or to a minor leak when the valve anatomy and leaflet motion are normal. A careful assessment of the regurgitant jet by color Doppler using multiple views can rapidly diagnose minimal regurgitation, which don't require further quantification. In the other cases, the use of a more quantitative method like vena contracta and PISA radius is advised when feasible. For valve assessment, transthoracic echocardiography is recommended as the first-line imaging modality in valvular regurgitation. And both vena contracta measurement and the PISA method are recommended to evaluate the severity of regurgitation when feasible. To measure PISA, we need a regurgitation. But what is a regurgitant jet? Abnormalities in cardiac valves give rise to pulsing reverse flow back through the valve. This is termed regurgitant flow, and the resultant jet of blood a regurgitant jet. Before measuring PISA, we have to identify the different segments of the regurgitant jet anatomy. The regurgitant jet has three segments. The first segment in purple is the flow convergence zone. The second segment in blue is the neck or vena contracta, and the third segment in yellow is the jet area or regurgitant jet. And the PISA radius is a measurement based in the flow convergence zone. The image on the left is a picture of a regurgitant jet, and we can clearly visualize all three segments. From top to bottom, we have first the flow convergence zone, second, the neck or vena contracta, and third, the jet area or regurgitant jet. The PISA method is a measurement based on the flow convergence zone. But what is the flow convergence zone? The flow convergence zone is the zone of increased flow velocity before the regurgitant orifice, just as the flow of water in a river increases prior to a rapid. Another analogy would be the swirls of water one sees in a bathtub close to the outlet. The velocity of the flow increases towards the regurgitant orifice in concentric shells, causing a more or less semicircular region of aliased flow. The size of this region corresponds to the magnitude of blood flow and the size of the regurgitant orifice. The flow convergence zone can be used to quantify the severity of regurgitation and is probably the most important part of the jet when it comes to quantifying regurgitation. The severity of regurgitation can be visually assessed based on the flow convergence zone. It may also be used to directly measure the volume of regurgitation and the effective regurgitant orifice area with the aid of the PISA method. It is quite difficult to quantify the size of the flow convergence zone. Quantification methods solely based on actual measurements have several limitations. However, trivial or mild forms of regurgitation are characterized by the absence of a flow convergence zone because they are too small to be detected with echo. In moderate forms, the flow convergence zone will be visible but small. In severe forms, it will exceed 1.0 centimeters. And what is the PISA method? PISA means proximal isovelocity surface area, and this is a method to quantify regurgitation based off of flow convergence. PISA method is able to provide us with regurgitant flow, effective regurgitation orifice area, and regurgitant volume. The PISA method is feasible to assess mitral and aortic regurgitation. Is validated in only few studies in tricuspid regurgitation and lacks published data in pulmonary regurgitation. With the PISA method, we quantify the regurgitation using the principle of conservation of mass by analyzing the proximal isovelocity hemispheric surface area of the flow convergence zone. This method is more accurate for central regurgitant jets than eccentric jets, and for a circular orifice than a non-circular orifice. The PISA method is highly recommended to quantify the severity of mitral regurgitation. And how PISA occurs? PISA is a phenomenon that occurs when liquid flows through a circular orifice. The flow will converge and accelerate just proximal to the orifice. PISA is the hemisphere itself, and the radius of PISA can be used to calculate the diameter of the orifice. The radius of PISA is measured from the narrowest segment of the regurgitant jet to the surface of the hemisphere. Color Doppler is used to obtain PISA. In color Doppler, aliasing occurs when the velocities are greater than the Nyquist limit. An optimal assessment of PISA requires adjusting the Nyquist limit until PISA assumes the shape of a semicircle. The PISA method is derived from the hydrodynamic principle stating that as blood approaches a regurgitant orifice, its velocity increases, forming concentric and roughly hemispheric shells of increasing velocity and decreasing surface area. Color flow mapping offers the ability to image one of these hemispheres that corresponds to the Nyquist limits of the instrument. Measurement of PISA by color flow mapping requires adjustment of the aliasing velocity such that a well-defined hemisphere is shown. This is generally done by shifting the baseline towards the direction of flow or by lowering the Nyquist limit or both. This is the same image of an aortic regurgitation. On the left side, we have a normal color Doppler scale of 62. On the right side, the baseline and the Nyquist limit has been modified in order to properly visualize the flow convergence zone and to measure the PISA radius more accurate. That's why we have to adjust the baseline and the Nyquist limit, because as you can see, the hemisphere or the semicircle is better visualized and the borders are sharper on the image on the right side. And the borders are not well defined and they are very diffuse on the image on the left. This is the PISA formula and is calculated from measurements of the distance from the aliasing velocity to the regurgitant orifice. The PISA method, like any method, has limitations. This method has been validated in many studies, but still has numerous limitations that need to be addressed. The regurgitant orifice is rarely round. Thus, the PISA is not a perfect hemisphere. Jets which are eccentric in origin demonstrate a PISA that is not hemispherical. The motion of the annulus during systole influences the calculation. Measurement of the PISA radius can be difficult. The PISA method is more accurate for central jets than for eccentric jets. It is also more accurate for regurgitation with a circular orifice. And if the image resolution allows the flow convergence to be seen well, and the Nyquist limit can be chosen at which the flow convergence has a hemispheric shape, it is easy to identify the aliasing line of the hemisphere. Also, it can be difficult to judge the precise location of the orifice and the precise location of the flow convergence shape. It's important to know that any error introduced is then squared, which can markedly affect the resulting flow rate and effective regurgitation orifice area. Alignment with the direction of flow is sometimes impossible, and multiple jets are usually present. Also, regurgitation is usually dynamic, and the mid-systolic frame might not be representative of regurgitation. And the PISA method cannot be used in calcified and prosthetic valves. Some of these issues are currently addressed with 3D echocardiography, which has been able to circumvent the problems related to the true shape of the PISA. At present, all of these limitations must be considered when using the PISA concept. The calculations should always be viewed in conjunction with other findings. And what are the advantages of this method? Even though it's difficult, the PISA method can be used in eccentric jets. It's not affected by the etiology of regurgitation or other valve leak. The PISA method can estimate the lesion severity and the volume overload. Is reproducible and is fairly easy to obtain. Now that we know everything about PISA, how to measure the PISA radius then? First, you have to adjust the focus setting to the level of the valve. Zoom in the image and use a narrow color sector to reduce error. Second, you need to properly visualize the flow convergence area or the flow convergence zone. Third, adjust the Nyquist limit to a value between 20 and 40 centimeters per second and shift the baseline downward. This will give you a larger hemisphere which facilitates the measurement. This is in the case of mitral regurgitation, and I know that this is the part that can be a little bit confusing. So you have to always remember, first, always shift the baseline towards the direction of the flow. In this image, I'm measuring the PISA of a mitral regurgitation. The blood flow is going downward. That's why I'm shifting the baseline downward. And second, if I'm moving the baseline downward, I have to make the bottom number between 20 and 40 centimeters per second. Normally you can achieve this by just shifting the baseline, but sometimes you will need further adjustment and you will have to change the scale. So again, this is the same image. On the left side, I have a mitral regurgitation and I want to measure the PISA. As you can see, the color scale is 61. Both numbers, the top one and the lower one, are 61. Because the mitral regurgitation flow is going downward, I'm going to shift the baseline downward. And my goal is going to be to make the bottom number between 20 and 40 centimeters per second. On the right-sided image, now you can see on the color scale that the top number is now 87 and the bottom number is 39. And thanks to these changes, we can clearly visualize the hemisphere line. Now we are back to this image for a second. As you can see on the left side, we have an aortic regurgitation with a normal color scale of 62, both numbers, the top one and the lower one. Now I want to measure PISA. I have to change the settings. Because the aortic regurgitation flow goes upward, I have to shift the baseline upward. And now my goal is to make the top number between 20 and 40 centimeters per second. I repeat, normally by just shifting the baseline you can accomplish this, but sometimes you will have to also adjust the color scale. As you can see now on the right-sided image, the top number is now 37 and the bottom number is 87. And thanks to this, you can clearly visualize the hemisphere line and you are ready to measure your PISA. So all depends on the direction of the regurgitation. If the regurgitant flow goes up, just shift the baseline up. If the regurgitation flow goes down, just shift the baseline down. After changing the settings, you will have a more clear convergence zone. Now freeze the image and you're ready to measure the PISA radius. The PISA radius is measured from the regurgitant orifice or vena contracta to the dome of the PISA, which is the point of color aliasing. So basically, I'm measuring the diameter from the narrowest part of the regurgitation to the point of color aliasing, which is the part where the color changes from yellow to blue. And always use the view with a better defined PISA. Now, severity ranges according to PISA. A PISA radius less than 0.4 centimeters is consistent with mild regurgitation. A PISA radius between 0.4 and 1.0 centimeters is consistent with moderate regurgitation. And a PISA radius more than 1.0 centimeters is consistent with severe regurgitation. And finally, I'm going to include a video of me measuring PISA. Really, this is not a difficult measurement. You just have to get used to the settings and you will see that you will do it automatically. I'm going to measure the PISA of this mitral regurgitation. I'm using color Doppler and now I'm going to zoom in the mitral valve so I can properly visualize the convergence zone. Because the flow is going downward, I'm going to change the scale and shift the baseline downward, making the bottom number between 20 and 40. There it is, 35. And I only shift the baseline downward 3 times to achieve this number. Now I'm gonna try to find the best semicircle to measure. All the measurements should be made at mid-systole. Now that I selected the best PISA, I'm going to measure the radius from the vena contracta to the dome of the semicircle, which is exactly the line where the color changes from yellow to blue. That's the limit, right there. And that's it, you have your PISA. Easy, right? Thank you very much for watching this video. Also, thank you very much for all your support. Don't forget to like this video and subscribe to my channel. Bye!